Can sunlight worsen your lupus symptoms? Have you ever wondered if sunlight could make lupus symptoms worse? This is a common concern for many individuals living with lupus. Let's break down how sunlight interacts with this condition. Lupus is an autoimmune disease where the body's immune system mistakenly attacks its own tissues. One of the notable features of lupus is photosensitivity, which affects about 40 to 70% of those diagnosed. This means that exposure to ultraviolet light, especially from the sun, can trigger flare-ups. When ultraviolet rays hit the skin, they can damage skin cells by affecting their DNA. In people without lupus, the body can effectively remove these damaged cells. However, for those with lupus, this process is not as efficient. The buildup of damaged cells can lead to an immune response that worsens symptoms. Common reactions to sunlight include skin rashes, particularly the well-known butterfly rash that appears across the cheeks and nose. Other symptoms that may arise from sun exposure are itching, burning sensations, joint pain, fatigue, weakness, fever, headaches, and even tingling or numbness. In some cases, internal organs may also become inflamed due to this exposure. It is important to note that photosensitivity is not limited to natural sunlight. Artificial sources of ultraviolet light, such as fluorescent or halogen bulbs, can also provoke symptoms. Additionally, the response to ultraviolet exposure may not be immediate. Symptoms can take hours or even days to appear after being in the sun. From the perspective of a rheumatologist, managing lupus effectively involves minimizing ultraviolet exposure. Patients are often advised to avoid sun exposure during peak hours, which are typically from 10 in the morning to 4 in the afternoon. Wearing protective clothing and using broad-spectrum sunscreen that blocks both ultraviolet A and ultraviolet B rays is also recommended. Being cautious around artificial ultraviolet sources is equally important. Taking these steps can significantly reduce the risk of flare-ups and help maintain overall health. In summary, sunlight can indeed worsen lupus symptoms due to its effects on skin cells and the immune system. Protecting oneself from ultraviolet exposure is essential for managing lupus and preventing flare-ups.